This video is speaking to two people. One is you, me, and everybody else that is interested in oral health. Second group are dentists who need to protect themselves when their reputation is on the line. My name is Josh G, and this is Unfiltered Business. In this video, we are going to be talking about understanding what oral lesions are and the clinical and legal responsibilities that come with it. I've had the brilliant opportunity to speak to two wonderful people on this topic. The first one is Professor Emeritus Dr. Rosnah Binti Mohd Zain. She is the Deputy Vice Chancellor of MAHSA University. And the second guest that I had was Shanti Abraham, a lawyer and a mediator. So let's get to the show. Prof. Rosnah, you had mentioned in your article that you had written that smoking, chewing tobaccos, chewing betel leaf can be one of the leading causes of oral cancer. But on that same note, you also said that is no longer the case. You're seeing people that never did such things or never had such habits suddenly develop oral cancer.
I didn't mean to say that it is not the main cause. Worldwide, it is still the main cause.
Okay.
Even in Malaysia, smoking is still the main cause. However, when we talk about betel quid chewing, that's very targeted in certain population only, which we can talk about later. But yes, I did say that we have to be aware because there are people with oral cancer where we do not see any of these lifestyle causes.
We see that medical negligence cases is on the rise with doctors and physicians. But is this creeping in now into the dental or dentists, the dental industry or the dentists?
Yes, we are actually seeing some increase in queries and complaints, and that is partly to do with the fact that because healthcare disputes have been rising for the last 25 years, people are more aware of their rights or perceived rights and expectations when they go to see their healthcare professional, whether doctors or dentists.
Okay. Let's just imagine this. Someone is just looking into their mouth and then they notice sort of a painless white patch. It's not painful, it's just over there in their mouth. And they don't do anything about it yet, but every day they check it is still there. They go to their dentist. And the dentist over there says, let's just wait and watch. 6 months later, that white patch has become bigger and it has changed. So what should have happened and what is the dentist's rights and what are the patient's rights is what we want to find out. So Prof. Rosnah, let's just start with you. And let's start with the basics, right? When we say oral lesion, what exactly does that cover?
Okay, the word oral is not so well used in terms, it's well used, but for the public, it may be a little difficult. So I will always say it's mouth lesions.
Okay.
That means lesions in the mouth.
Okay.
I would like to correct the misconception that dentist only does teeth and there's nothing else in the mouth. So when we say oral cancer, they say, what? You have cancer of the teeth? No, basically the mouth has got a skin.
Oh, okay.
We call it mucosa.
Okay.
All right? And our skin now turns around at the lip. So you can see the difference in it. In the skin, it's dry.
Right.
In the mouth, it's wet. So that's why it looks a little different. All right? So oral lesions means anything that is slightly different from the oral mucosa, which actually means that the normal oral mucosa is pinkish. So you may get whitish, you may get reddish, or you may get ulceration or erosions. So those are things that we call abnormalities in the oral mucosa.
Will this lead to bleeding?
No, bleeding is more when you talk about gum disease.
Okay.
You can get to a stage of bleeding. For this, if we talk about early lesion, there is no pain, and there is no lump, and there is no bleeding. So that is why a lot of oral lesions get missed.
Right.
And patients also do not realize they have something that's abnormal in the mouth.
And how is it that this is not painful? or you can't sense it. Is that right to say? Whether it doesn't have to be so painful, but you should be able to feel it.
Okay.
How is it that you can't
Yeah,
feel?
basically, I have to get into pathology.
Yep, go ahead,
Okay,
go
or
ahead.
histology. So basically, when you talk about oral mucosa,
Yep.
you talk about in histology epithelium.
Okay.
Epithelium is just, and then under the epithelium is connective tissue, and that's where all the blood vessels, the nerves are. So changes like white lesion is actually maybe changes of the epithelium only or superficial part of the connective tissue.
Okay.
Changes like red lesion, it could be the epithelium is now eroded. They becomes red. Or there can be changes which are potentially cancerous, precancerous.
Right.
Okay? They becomes red. But when it is an ulcer, there are two types. One is erosion, meaning that part of the epithelium has been eroded, but it has not reached the connective tissue. The other one is a true ulcer. The whole of the epithelium is not there, and you get to the connective tissue. Then you start to get some slight pain, burning sensations, things like that.
Brilliant. So how can a lay person differentiate something that is benign and something that needs immediate attention? Like, explain this to me like I'm a 10-year-old. How do I know when I look into my mouth, I see something over there? Is that something that's benign or something that I need to do something serious about immediately?
Okay, I've done this with my grandson.
Okay.
So anyway, basically we must be always looking at the lining in the mouth, which is the oral mucosa, and not just the teeth. I think everyone should be familiar that it is pinkish and there's no
Right.
break. As soon as there is those changes that I mentioned earlier, I do not think that they can tell which is okay, which is not okay.
Right.
So the best advice will be to go and see a dentist
Okay.
who will look and decide whether this is potentially malignant or this is not.
Okay.
Because dentists are trained from school, from dental school, and also they are retrained when they are at work, especially in Ministry of Health.
Very good. Okay. So Shanti, just taking on from what Prof had said, right? They see something and they go to the dentist. But let's go back to my first example. Someone sees something in their mouth from home, then they go to the dentist, and the dentist say, let's wait and see. Maybe it's not something so serious. 6 months go by, and it turns out that it is something serious. It could be cancer. It could be something else. How does a dentist protect himself or herself in this situation?
Well, first it goes back to the relationship between patients and dentists. They are both partners in the healthcare. So a patient has a choice of whichever dentist they pick, right? So if at the first dentist said, well, let's wait and see, and then the patient comes back to the same dentist, then the dentist should have had at the beginning some notes which would have identified this as a questionable marker or a lesion to be looked at.
Okay.
Now, whether it develops into something adverse or not is not really within the dentist's control. The responsibility of a dentist is to warn the patient that this is something that needs to be watched. Now remember, there is no obligation for a patient to come back to dentist number A. They can certainly go and see another dentist. Now what happens at that point becomes the question, because dentist B may have not seen that this lesion had been developing over the last 6 months. And if in the history taking, the patient does not disclose that a previous dentist had noticed something, then what happens is dentist B has to deal with what they see.
Okay.
So it is very important that dentists have good communication with the patient. Now, the moment you say communication, you realize that half the time a patient's mouth is open and there isn't really a great dialogue happening between a patient and a dentist. So this is where we're hoping that dentists understand that they have a role to play before they start to examine the patient
Yep.
and to commit time and effort to having a communication after
Okay.
they've been investigated.
You covered a few things that I'm going to ask later as well, like documentation.
Yeah.
But sorry if you've got to repeat yourself. But,
That's fine.
Let's come back to what Prof was saying, and correct me if I'm wrong. When somebody has early signs of oral cancer, it is not that those lesions can be seen. It is not like those lesions are visible at a very early age, or early stage, sorry. So if the dentist that checks it says, I don't see any signs of it, or doesn't advise for cancer care, but later on, if that develops into cancer, does the dentist carry any liability?
So every case is fact-centric. So it's not such an easy answer.
Okay.
Because we're moving, and it starts with the first question you asked me, the increase in claims and cases.
Yep.
We've come into a culture where we try to find blame or allocate blame.
Yep.
And when someone is faced with the prospect of potentially a cancer, the cost, the trauma, there might be a tendency for them to look for someone to blame, even though actually it might have been sourced from their tobacco chewing. Right. So I think for the purposes of a dentist or someone who is working in this sphere, what they need to do is to make sure that we come back to documents. And just to sort of put a punctuation point on that, we always say in our medical legal world, if you have good documents, you will have a good case. If you have poor documents, you may have a poor case.
Okay.
And if you have no documents, you have no case.
Right. So, Professor Rosnah, what would be the red flags that somebody, if they're just doing some self-check at home, what would be the red flags they need to take note of when they notice certain things in their mouths?
I find it really difficult
It is?
to talk about red flags in
Okay.
early lesion.
Okay.
When you talk about late lesions, definitely do not ignore.
Because it's
If you
very
have a
clear by then
swelling.
already.
Okay,
right?
because a lot of people ignore that. They have a swelling, the swelling is reddish, there's ulcer on the swelling itself, and it actually affects the eating, swallowing. Because there's
Swallowing also.
well, it depends where it is. I mean,
Right.
there is oral cancer. There is also what we call oropharyngeal cancer at the back of the tongue.
Okay,
Is
okay.
oropharyngeal cancer, and that definitely will affect swelling.
Okay.
However, so those can be the red flag which they should know. Because it's towards late cancer. The other thing that they should know is if they develop little bumps along the neck. Lumps along the neck.
It
That
shows,
is because the lymph nodes may be affected. But it's a red flag for them to go and see someone, because it doesn't mean the node has cancer. It can also be inflamed nodes, but you still have to go and see someone for that. But when it comes to the other lesions, where I'm talking about flat lesions, we call them oral potentially malignant disorders.
Okay.
So these, as long as you see white lesions, as long as you see red lesions, and I'll talk about the ulcer afterwards, you should at least go to the dentist, and the dentist will make a decision, because they're trained, whether some of these are normal variants of oral mucosa, need to do nothing except to reassure the patient, or these are possibly not cancer but need to be sent to a specialist, because these lesions may also be related to an overall systemic condition.
Okay.
So there are many things that you do, and of course the white lesion is may be related to developing into cancer.
Oh, okay.
Yeah, I mean, it may not be cancer. So all these dentists would be trained enough to actually refer to the specialist, because the specialist will have different armamentarium to actually finally decide, which actually finally may even go to a biopsy.
Speaking about oral cancer, I want to talk about our sponsor that helped us bring this video to you. We brush our teeth, we floss, we rinse, and we think that everything is fine with that. But what happens when these good habits start to become inconsistent? But have we ever thought that neglecting oral hygiene can lead to serious consequences. Consequences like what we're talking about in the show, oral cancer. Our sponsor for the show, Aquapick, has been trying to improve and promote healthcare that just toothbrushes and flossing will not do. They have a device which is a cordless oral irrigator that protects your teeth and gum line through a powerful stream of water that will clean between the teeth and the gum lines. Through its powerful water stream, this cordless irrigator removes food debris that is still remaining around your mouth and gently massages your gums. A few dental health journals and associations have said that poor oral health can lead to pneumonia, can lead to asthma, can lead to cardiac arrest and diabetes. Today, let Aquapick lower or remove those risks completely. Aquapick has more than just their oral cordless irrigator. If you go and check their website, you will see so many things that they're offering. As a matter of fact, if you go on to Shopee today and you look up for Aquapick's official store, for everyone listening on to Unfiltered Business, you get a 15 ringgit off all their items. All you have to do is when you make your purchase at Shopee, you just have to key in the voucher code of UFLTD15 and you will get your discount. But don't worry, the details will be at the comments below. Shanti, I know when we spoke, you said that it is very difficult to cover the duty of care of a dentist, right? But what would be some
it can be a 4-hour lecture, but yes.
But that being said, what would be the ethical practices that a dentist should consider when, meeting or dealing with a patient?
So that again is a whole swath of duties and ethical duties. But perhaps what I can do is I'll zero into say the 5 top things that might be of benefit to listeners. The first thing is to establish a protocol. If you're a part of say MOHH or KKM, you would have certain standard operating procedures which you will be trained to comply with, from consent to record keeping, etc. But when you come into private practice or you work for someone,
right,
that's where you have to be self-guided or guided by the corporate decision makers. Now, corporate decision makers don't always look at things from a risk management perspective, although they are increasingly doing so.
Okay.
Simply because one allegation of negligence or a complaint of misconduct can take up so much time or from away from their practice. Now, so one aspect is to have an operating procedure. When the patient comes in, history taking is something that's important. Record keeping is something that's important. Having the patient be candid about what a previous dentist may have advised them to about as well is important. Then there is also the dialogue and the communication with that particular patient. Now, one of the real issues that I understand from dentists and others that I've encountered and advised is that there is very limited patient loyalty nowadays because they are looking for the next cheapest dentist or the next deal in town.
Yeah.
And in doing so, they are not actually committing to a relationship with a dentist, which can be extremely important, even if they are seeing the dentist only once every 6 months. So that relationship doesn't happen by magic. It happens by communication. So I know that I'm not quite talking about the ethical responsibility. We want dentists to engage in authentic relationships with their patients, and really that is the rudder of that is the rudder of ethics as well. You do not oversell procedures because that can make your patient feel lack of confidence in your commercial ethics as well. So there are multiple layers to this, which every dentist needs to really focus their mind. What do they want to do for the best interest of their patient? And to engage in a relationship, which in the long term will bring the commercial benefits.
So if a patient feels like their dentist is being dismissive about their concerns, they go and say they got an oral lesion, but the dentist is saying it's okay. Now, what should a patient do for themselves
Right.
without damaging that relationship that they've built with the dentist?
Right.
Because I think that usually people go to the same dentist. Very rare you find them moving to another dentist, right? But if they find that dentist is not being dismissive of their concerns, then what should they do without damaging that relationship?
Right. So I don't think patients think too much about the relationship. To a large extent, and this is a very sad part of it, today all professionals are service providers at best. And it appears that, from your perspective, these relationships are semi-permanent. But from what I understand from the ground, it's quite tenuous.
So they are
they
willing to
will
move.
change, they will
Okay,
explore,
okay.
they will try and because not all dentists are sitting in that seat all the time. There are locums. It has become a little bit of a revolving door in terms of who will be examining them.
Sure.
But I'm going to take that question and evolve it a little bit.
Yep.
There are two ways of doing this. One is the scenario which you presented, which is where the dentist has highlighted has been dismissive.
Yes.
Has been dismissive. Now, and if the patient has a doubt, they can always go to another dentist. Remember, they are stewards of their own health. And this is something we have to really reignite in our society.
Yep.
That doctors and dentists are not gods. They are not there with this constant duty to have to call you up and remind you to come to check your teeth, for example, or run your blood test. We are all stewards of our own health.
Yes.
That's number one. Number two is the reverse, where a dentist notices something that concerns him or her, and then alerts the patient and then suggests that the patient needs to do a short regime of investigation.
Right.
And Prof. Rosnah alluded to that. That would be what a responsible dentist would do. Now, that a cost usually comes with that.
Of course.
And sitting in the patient chair, that's the thought processing that the patient's going to have. Is this dentist trying to make a bit more money from me? Do I really need this? It could not be serious. It could be serious. Now, this is where dentists have done their part after highlighting the problem. And then what they need to do is they need to record that they've told the patient, because 6 months from now, everyone's going to forget what the dentist said and how the patient received that information.
Correct. So now I want to go back to what both of you all had spoken about documentation. So Prof. Rosnah, what should be in the patient's report if a dentist sees a suspicious lesion in his mouth or her mouth?
Yeah. Okay. The dentist should actually describe that suspicious lesion.
Okay.
And as part of the report, we have what we call a mouth map.
Mouth map.
Yes.
Oh, okay.
It's a diagram. It's a diagram.
Okay.
Where it will show the cheek, the tongue, the lips.
Right.
So the best, it's not every dentist will do it, but the best is still to circle the area, approximate size, and document that,
Brilliant.
the color
Very good.
and all
Very
that,
good.
as well as write. So that is the best.
Okay.
Okay, and I would like to add over what you say about going to the same dentist. Yes, patients move from dentist to dentist.
Okay.
However, once they have something in the mouth that is more related to lesions, then, and especially if the dentist already says something about it, they should really follow through with the dentist. For
Absolutely,
example, I mentioned
absolutely.
about the ulcer. To determine it is traumatic or not, the dentist need time. The dentist cannot just say, hey, I think this is traumatic ulcer just because I see a broken down tooth, because it could just be coincidental.
Right.
All right? So that is the most important when it comes to having an oral lesions.
Okay. And then still back on the topic on documentation, Shanti.
Yeah.
How will this report that Prof had just mentioned become the most important piece of evidence in a legal dispute?
It doesn't become the most important. So in a legal dispute, what would have transpired, and now we are sort of crystal balling into a potential dispute, right?
Yep.
Would have been that the patient is unhappy about either the treatment that was recommended, the suggestion that there might have been a a belated diagnosis. There could be a raft of reasons why that particular patient is unhappy with either the dentist or the dental clinic, how he was handled, he didn't get an appointment when he wanted. There could be a raft of reasons. Now, at the end of the day, when it comes down to a debate on where the liability may lie, you need to have another expert come in and weigh in on this.
Okay.
And so the patient has to actually approach another dentist to ask that dentist, how would you have dealt with this had I been your patient?
Right.
Now that dentist will then give an expert opinion on what I describe as the gold standard of how this matter would have been dealt with by him or her.
Okay.
Now, that actually becomes the most important document in a dispute, because many times in that expert view, you get a bit of a balancing, or you get a suggestion that there has been negligence.
Okay.
But it comes back down to, and I think we'll be speaking a little bit about it, that not all disputes need to be battled out in court.
Yep.
And I personally feel that it is really a waste of a lot of people's time to take that protracted journey.
Yes.
And there are some other clever
Yes.
ways of solving problems.
And I'm coming to that other ways of solving it. So, can you explain the role of mediation?
Right.
When this case erupts into
Right.
something.
But first, maybe let me spend a few minutes. What is mediation?
Go for
to
it.
begin?
Yeah, absolutely.
Now, all of us are familiar with the battle in court, that image in all our minds with a judge at the
Yes.
apex with the
Yep.
two lawyers fighting, and then you've got the parties who are the ones who are battling it out. Now, that traditional idea results in a winner and a loser. Now, in our Malaysian context, if you are a winner, the loser can appeal against the decision if they feel that the judge has made certain errors. So just finishing a case doesn't mean it's the end of the case. There is still a journey to be carried through. Now, mediation is a relatively modern dispute resolution method, although the concept has been around in Asian culture for thousands of years. And that is where dialogue is used to discuss and to find a solution to a dispute. We don't speak in terms of winners and losers. A common parlance is a win-win situation. But for those of us who are in the space, we actually say lose less, lose less. That's the real outcome out of a mediation. And how mediation is different from a typical litigation is this. The parties must first volunteer and agree to be part of a mediation process. They can have their lawyers there, and I feel that lawyers are a very important part of a mediation process. During that mediation, one extremely important part, which is the real value, is everything that is discussed during that mediation is confidential. You can't talk about it outside. And Malaysia has had a mediation act for now more than 12 years, unlike many other countries. So confidentiality is statutorily protected. Not only that, the parties can discuss things and make suggestions without being held to it. So you can even make an offer. I'll pay back, your fees, for example, as part of the solution for parties to consider. Now, an additional benefit in my mind to mediation is that the person appointed to be the mediator, who is a neutral person, the person does not make decisions, but the person navigates the communication, and in that process observes body language, observes how they are speaking, tone of voice, and tries to understand what the real interests of the parties are, as well as the motivations for the dispute. So it is not just the words, but the full picture. And a mediator has the opportunity to have private conversations with each party, right? And in these private conversations, a lot more can be mined out of these conversations.
Right.
Now, each of those private conversations remain confidential. So it's only the mediator who knows, for example, that on account, let's just use a mouth lesion example.
Yep.
On account of a mouth lesion, someone's spouse has stopped kissing him or her.
That's
and
quite
that has spoiled the marriage, and now that person is in a emotional spiral.
Right.
And actually, if he thinks about it, I just made that patient male, but if he thinks about it, it's all because of the dentist. If only the dentist had fill in the blanks. then his whole marriage would not have failed. Now, you can see that because in the mind of a disgruntled or upset person, a lot of things are connected. And this is where a mediator can do a bit of reality testing. And that would have been through the evidence or the information from the other side, saying this lesion was caused by his betel nut chewing, for example, right? And so you have an authentic conversation, and from there, you then have a conversation of what to do next, so that parties have a landing on how they want to solve it. Now, if they fail in resolving it in mediation, which is typically 1 to 2 days over a short few months, they are welcome to go to court and battle it out for a few years. That remains the parties' choices as well.
That was all for Unfiltered Business today. I hope you took back something. I hope you found this episode useful and informative. I will see you in my next episode.